guys, this is Dr. Hub. Today we'll look at the rabies vaccine. So we are looking at the rabies vaccine and also the immunoglobulin schedules. So immunoglobulin schedule. So first, to begin with, we look at some categories. So it is divided broadly into three categories of how the injury takes place. So in category 1, it includes the touching or feeding the animals and also licking the intact skin. So also the licking present in the intact skin. So this takes place and there is no exposure. Next one will be the category 2. So as per the category 2, there is nibbling of uncovered skin. There is nibbling, and this is of the uncovered skin. There is also minor scratches and abrasions without the bleeding. There are minor scratches as well as abrasions. This is without the bleeding. So here there is previously there was no exposure, here there is exposure. Next we look at the type 3. So in category 3, there is a single or multiple transdermal bites. So single or multiple, and this is going to be the transdermal bites. Or we can also call it scratches. There is a contamination of the mucous membrane with the saliva. There is contamination. This is of the mucous membrane, and this is with the saliva from licks. This is from the saliva and it is from the licks. Also the contact with bats. Contact with the bats. So this all makes it a severe exposure. So let's see a case. So this is all in accordance with the Ministry of Health and Family Welfare by the Government of India. So it's as per the Ministry of Health and Family Welfare, Government of India. So first let's look at pictorial representation. So first there is a suspected or confirmed rabid animal. So there is a suspected or confirmed rabid animal. So here there are two kind of categories. So first one we'll look at in case of it is non-immunized. So in case the person is non-immunized, what will happen? So here there is category 1. Category 1 means there is only wound washing. Then comes category 2. Category 2 involves the wound wash plus you do PEP. Third one will be the wound wash plus PEP, and there is an addition, that is there is RIG as well. So here there is a PEP, that is a post exposure prophylaxis. So what is the thing? There are 5 doses to be given, and it includes the SN regimen. So here how is it? So here this will be given in terms of the IM. So IM is basically 1 1 1 1 1. So this is administered on days of 0, 3, 7, 14 as well as 28. Or there is an updated thigh cross regimen. There is an updated thigh cross regimen. So this indicates that there is a 2, 2, 2, 0 and 2, and this will be administered on days 0, 3, 7 and 28, and it will be given on two sites. So this was about the non-immunized individual. Next is, in case of an immunized individual, what is the procedure? So in terms of immunized individual, there is a previously immunized person, including the PREP. So here there is a category 1. Category 1 means you just do wound washing. Category 2, it involves 3 as well as 3, 2 and 3. So this involves the wound wash, and it involves the booster on days 0, 3 ID or IM, 0, 3 ID or IM. So here the RIG is not indicated. The RIG, it is not indicated, whereas the wound treatment and the booster days on 0 and 3 can be followed. Then we also need to know that the WHO category 2 and 3 exposures, 2 and 3, this exposure should receive post exposure prophylaxis immediately, and one intradermal dose of 0.1. So there's an intradermal dose, and this is 0.1 ml. This is a vaccine, and one IM injection and one IM intramuscular injection, one intramuscular dose. This is basically an entire vial of vaccine. The vial of the vaccine. So this is irrespective of the vial size. So irrespective of the vial size. Next is that should a vaccine be delayed for any reason? So in case if there is a delay of the vaccine for any reason, the PEP schedule should be resumed. So in case of a delay, the PEP should be resumed. This will be in case of the delay. So now let's look at the rabies immunoglobulin. So rabies immunoglobulin, this is RIG in short, rabies immunoglobulin. So here it's basically a passive immunization, and there is presence of a single dose. And this will be after initiation of PEP. This will be after initiation of the PEP, and it is not beyond the 7 days after the first dose. It is not beyond 7 days of the first dose of vaccine. So what is the max dose? So looking at the max dose will be the HRIG. It is going to be 20 IU per kg, Then comes the ERIG. This will be 40 IU per kg body weight. Now the vaccine should never be withheld. So the vaccine, it should never be withheld regardless of the availability of RIG. So we should never consider the availability of, regardless of the availability of the RIG. Next, what are the alternatives of the RIG? The alternatives is that of RIG. This includes the WHO. It recommends the monoclonal antibodies. There is a monoclonal antibodies, and this is nothing but a cocktail. Nothing but a cocktail, and it contains at least 2 antibodies against the rabies vaccine. So it contains 2 antibodies against the, so it is at least 2 antibodies against the rabies vaccine, rabies virus. Now let's look at the administering the RIG. So how do you administer the RIG? So the RIG, it should be administered into or around the wound site. So into or around the wound sites, and the remaining RIG, so the remaining RIG, if any, should be injected IM at the site, distance from the site of vaccine administration. So the remaining RIG, it should be injected IM. So it is injected IM at the site distant. It is to the site distant from the site of vaccine administration, from site of vaccine administration. Next is the RIG may be diluted to a volume. So next is the RIG. If you see, it can be diluted, and this is to a volume sufficient for the wounds to be effectively and safely infiltrated. So diluted to a volume which is sufficient for all wounds to be effective. So all wound to be effective and safely infiltrated, and it is safely infiltrated. So how do you prioritize the RIG allocations? So prioritizing, this will be by the numbered according to the priority. So firstly, there will be in case of multiple bites. This is first. Then comes in presence of the deep wounds. Next is bites. These bites are present in the head, neck, and the hands. Then comes the patient with severe immunodeficiency. Patient with severe immunodeficiency. Then comes the confirmed and the probable rabies. So there is confirmed or the probable rabies, and this is nothing but in a biting animal. In a biting animal. The last will be the bites, scratches, exposure of mucous membrane, and this is caused by bat. Next we look at the PREP, that is a pre-exposure prophylaxis. So PREP is nothing but the pre-exposure prophylaxis. So here there are different groups. So first let's look at high risk. So what is meant by high risk? In high risk groups there is a lab staff, laboratory staff, then there is also the wildlife wardens. Next comes there is the veterinarians and also the animal handlers, then also the travelers to the endemic regions. So all these are high risk. Next is remote, that is rabies endemic. Rabies endemic areas, and this is where the access to the PEP is difficult. So the access to PEP is difficult. Then comes the areas where the dog bite incidence is greater than. So in case of areas of dog bite, this is greater than that of 5% per year. And also in case of areas where the vampire bat rabies is known to be present. Next, let's look at the other thing is in case of the pre-exposure rabies vaccination. So exposure rabies vaccination, it consists of 3 IM, 3 intramuscular, or they can be 3 intradermal. So these are nothing but doses, and they are given at various days, that is 0, 7, 21 as well as 28. So 4 days. And looking at adults, so in case of adults, the vaccine should also be always be administered in the deltoid region of the arm. And in case of young children, it will be given under 1 year of age, and the administration into the anterolateral area of the thigh. So anterolateral area of the thigh. Next is the rabies vaccine. So in terms of the rabies vaccine, it should never be administered in the gluteal region. It is never. So never in the gluteal. So never in the gluteal area. Administration in this manner will result in the lower neutralizing antibody titers. So it will result in the lower neutralizing antibody titers. Next is for exposed. Next is for the exposed or re-exposed patients. So in case of the exposed and re-exposed patients who can document a previous completed of PEP or PREP, for the guidelines it should be applicable. That is, there is a proper wound management should be done. So proper wound management should be done. Next will be, there should be no need for the administration. This will be of the RIG. Next is a one-set ID or the IM vaccine. So this is administered on the day 0 as well as day 3. So only adequate wound washing would be required in case of re-exposure. So you give a adequate wound washing. Adequate wound washing, it should be required in case of re-exposure. This is where the animal bite victim has documented proof of complete PEP within the last 3 months. So this complete proof when they are having it within last 3 months. The following cases are treated as fresh cases. So in case of and given full PEP. So what are the conditions for the fresh cases? So in terms of fresh cases, it can include those who have previously received full post-exposure, who have received full post-exposure treatment, and this is with the neural tissue vaccine. This is a neural tissue vaccines or vaccines of unproven potency, vaccines. Next is those who cannot document the complete, can't document the complete PEP or the PREP treatment. So this was a complete detail on the rabies vaccine and the immunoglobulin schedules. To learn and grow daily like this, please do subscribe.